If you receive an IM injection and after some hours or after a day or two, you realize that that place is swollen, listen, this is what you should do. Because right now, there is a case that we are handling, a case of a quack, or what you call your auxiliary nurse, gave someone an injection, and after 2 days or thereabouts, or 3 days, the place became swollen. The mother of the boy went to the quack and told her what happened. She now instructed her to place an ice on top of that place, on the skin. That you should leave the ice until it melts, and when it melts, you should place another one. This woman did as she was instructed. Instead of the thing to get better, it got worse, and eventually they landed at the hospital. Now, when I saw the thing, I asked the woman some questions, and from my own assessment, I don't think the injection might be an issue. I don't think. The issue there is management, the management of the swelling that occurred afterwards, the management. Because from all the indication, it looked like the guy had what we call, you refer as frostbite. That is, the ice has damaged the tissue and has damaged the nerves. Because when I look at the injury, it didn't look like an abscess, and according to the woman, there was no pus, so it looked more like a burn, and the thing eventually got infected. So here is what you should do. If you had an injury, if you had an IM injection and you realize that the place is swollen, you get an ice. You don't place it directly on the skin. That is number one. Wrap it in a towel or in a hanky or in a wrapper. Wrap it, then you place it on that spot. Don't place it directly on the skin. And when you place it on the spot, after you have wrapped it with a piece of cloth, leave it for maximum 10 minutes. That's the length of time you can leave it. Maximum 10 minutes. Don't leave it too long. And then you remove it. And don't allow the ice to melt on the skin. No, that is not the way you should be done. That's not the management. Don't allow the ice to melt on the skin. So when you leave it for that maximum of 10 minutes, you remove it. Let it be. Then before you place another one, is what is called intermittent. It's intermittent something. It's not something you leave it at there and all the day. No. Because when you leave it there, it will damage the tissue. It will damage the nerves. And eventually the leg will become paralyzed, and it will cause that burn, that ice burn. Just like there is hot water burn, there's also ice burn. You see it will cause the skin. The skin will peel. Because when I looked at that and I assessed it, it wasn't an abscess. I don't think so. From my own assessment, I don't think so. And the woman even said there was no pus, because abscess will actually form this boy, and then when it will bring out pus. So in case you find yourself in similar situation, maybe you went for your injection, they gave you an IM injection on your buttocks or whatever, whether it's a quack or even the registered nurse that gave you, it can happen. So what you do, the ice management is there. You take your pain relief and it will go. So when you are doing your ice management, do it in a proper way. Don't leave it for too long. Don't apply ice directly on your skin. It will damage your muscle tissue. It will damage the tissues. It will damage the nerves. Please share this video so that someone will learn.